And so on to our special look at children this morning. We all know the rates of child abuse in New Zealand are a national disgrace. Listen to these numbers. To the end of June this year, more than 150,000 cases went to Child, Youth and Family. Of these, nearly 5,000 cases of neglect were found. Over 3,000 cases of physical abuse. They found, this is a 12-month period, 1,400 cases of sexual abuse. Up to 10 children are killed in this country each year, and every time the children are killed by the ones who are supposed to love them the most. And so when it all happens, we say never again, and the carnage continues. However, the Social Development Minister, Paula Bennett, has come up with a new plan. Her white paper on vulnerable children. Greg Boyd spoke earlier to Paula Bennett and began by asking why she's targeted this particular 30,000 at-risk children and how she defines at-risk.
Well, we have defined at risk. It is those that are currently being maltreated, so we know are being abused or seriously neglected, and then those who we predict will be, and we can do a number of factors that means that we know which children we need to focus on. But it's pretty horrific when you've got Auckland University researchers turning around and saying they think 5% of our children's population are at risk of serious maltreatment. We have to do something.
UNICEF, Bernard, and a number of other groups have said the number's too small. 30,000 is too small. It needs to be a universal number, all kids under a certain age, as is in the Netherlands. Why have you not gone down that road?
Well, we do a lot of work for all children, as we should. So we have a whole lot of universal initiatives, programs that are going in. I find it horrific. We've got 30,000 children that are potentially living little lives of hell. We have to focus on them. It's unpalatable. We all like to think it's not happening. It is. They are at risk of death, to put it quite bluntly. We have to do something for those that really need it.
OK, it's 30,000. This is going to sound facetious and it's not meant to be. What about 30,001, 30,002, 30,010? Where do you draw the line?
I hear you, and that's what we've debated up and down this country through the Green Paper process and also, amongst ourselves as we were writing it. Where do you draw that line? Look, it doesn't mean that if you're 30,001 you're not going to get services, because there's a whole lot of other pieces of work that are going on across other children. But I am
it goes back
point
to
blankly
the universal thing, doesn't it? Just spreading the net wider than saying 30,000.
I could easily have gone and scattered more money around and hoped that I actually got it to the children that needed it most. I am blanketly targeting, and these are the children that I'm targeting. And we can debate where that line should be, and that's fair enough. I've drawn one. Those 30,000 children need it most.
OK, the money we're talking about is $20 million.
To start with, but that's just new money that goes in so I can set things up. But there's other programs that will be integrated into it. There'll be other money coming in through future budgets. It's not just me either. I've got health on board, I've got education, I've got the New Zealand Police, I've got the top ministers all sitting around and saying we will prioritise these children, and I think that's pretty outstanding. $20 million, when you look at the size of the problem, and even 30,001 or 10 or 40,000 or whatever, doesn't sound a lot of money. Because a lot of money's already going in. Actually, Labor threw a lot more money at it. OK, a lot of money's already going in, but it's clearly not working that well. So what difference is 20 million going to make, and when's there going to be more? So, well, I don't think it needs more money. If throwing more money at the problem was the solution, then quite frankly we would have seen fewer children being abused and neglected by the end of Labor's term. We didn't. We saw more. What it takes is a concerted plan that puts the right identification across these children, and then an individualised plan that sees to them having better outcomes, and that's what this plan does. Are you saying, though, that a family in South Auckland who's really struggling now, the 30, 40, 50 bucks a week isn't going to make a difference? Because a lot of people would say that would make quite a difference. We're talking about two different things. So at one stage I thought you were talking about more money for those organisations that are working with them. We're talking about where money's going to go. Now you switch to individual money. Of course not. And quite frankly, the best thing we know we can do for them is get them off welfare and into work. We have seen too much evidence that tells us actually that two families on the same income, one's on a benefit, one's a working family. It is that working family that will have completely different and better outcomes for their children across all of the kind of dimensions, whether that be educational, health-wise and everything else. So our focus is connecting those people better into work, making sure they have the skills, and we put 287 million new money into them at the last budget, and you'll see significantly more going in at the next one. OK, $20 million.
exactly what's it going to be spent on, and when can we see that money making a difference and those numbers falling?
Yeah, so we're going to spend that 20 million on setting up the new Child Protect line. That will make a significant difference. So that's where calls go into and how they're triaged. We're going to set up 2 pilot children's teams. I've announced one in Rotorua. We have the setting up of the information system and that database, and then the risk predictor tool. So that money goes pretty quickly, to be honest, because that's how it does. But you will see us setting them up as of, quite frankly, they're working on it today. And that will be set up. We've got timelines through the Children's Action Plan, but by July next year you will see people on the ground with the right sort of information and systems, and it'll be thanks to that money.
Those are the systems. When do you hope to realistically see a change in the stats, see a drop in those numbers? Well,
the good news is we already are. So what we have been doing is working somewhat. We just need to up that momentum to another whole level. So in Rotorua, for example, yesterday, in 2010, they had 879 substantiated cases of abuse and neglect. This year they've had 529. So we are seeing a drop. I just want that to be better. 529 is too many in my book.
Let's talk about cause. What do you say is the major cause of child abuse?
I think it's incredibly complex. I think it's intergenerational. I think we have an underlying current of violence towards our children that is quite frankly unfathomable. I think that poverty is one of the causes. I think it's relationship. I think it's a lack of self-esteem, particularly with some of our young women and the partners that they're choosing, because we see it as non-blood men that actually hurt these children more often than not. I can give you a list of 100 different factors. It is complex, is what I would say to you.
Poverty, let's talk about that. Much has been made of that. You said on Thursday, if I can quote you here, poverty doesn't cause child abuse. Yet there's a report here from your own department, I've got it right here, saying that one of the main risk factors for child abuse is poor housing, financial deprivation and unemployment. It is a key part of it. Why is that not being addressed a lot harder in this report?
Because we're addressing it through a whole lot of other means, and why would I duplicate the work that's going on with the Children's Commissioners and his experts group? Why would I duplicate the work that's going on with the Ministers' Committee on Poverty? This is a separate piece of work that doesn't undermine what is going on with those and will take them into consideration. But we are focusing on those 30,000 children that are most definitely need us. I don't deny poverty as being a part of or having some part to play, but quite frankly I know a whole lot of poor people that do not abuse and neglect their kids, and I really get angry when it's used as an excuse.
OK, let's talk about some specific examples, some of these terrible stories, and we know these names so well. The James Whakarurus, the Hinawaire ki Kariaitian Matiahas in the past. Had they been the kids of affluent or at least comfortable families, would those cases have happened? Would there have been abuse? Would there have been deaths?
Well, I don't know. I don't have a crystal ball. I can't go back in time and make that.
Well, the answer is probably no.
Well, unfortunately, I do see the children of some fairly wealthy people that are sadistic and actually treat their children appallingly. So I'm not saying, but would you really turn around and say if they had an extra $50 a week, those kids wouldn't be dead? I think that's a bit too simplistic as well.
A lot of people would say that, though.
Wow, would they?
Yeah, they would, and they have been this week.
Wow.
You've heard the figures about 270,000 kids in poverty, and these kids are, in your critics' opinions, being ignored. Not all of those can be changed with $50 a week, obviously.
But then you turn around and reading the paper today and it says, here's the child that didn't have breakfast that morning, and then they interview them at the dairy and they're spending $20 on Coke and pies. So really, was it that they didn't have the $20, or did someone just not make their breakfast for them that morning? So, I mean, it is just such a simplistic argument to what is an incredibly complex problem, and I think this paper deals with those complexities. And to turn around and say that it is just an argument of poverty says what those that are post-war that crikey had, I'd show you poverty. They didn't go around beating their kids like we do today.
So do you acknowledge there is a link, but it's not the link?
Yeah, I do acknowledge there's a link, without a doubt, and I say that in the paper, and I really am looking forward to the recommendations that are going to come from the Children's Commissioner and his expert work and expert group, and we will pick up some of that work. I have absolutely no doubt. Look, I want kids thriving, achieving, growing in this country. I will do whatever I can. But right now, I lose sleep over those kids that are being, quite frankly, beaten, and one dies every 5 weeks in this country in the hands of someone that's supposed to love them. I've got to intervene more.
How do you do that from your point of view, from where you are in the system? I mean, I've no doubt at all, you've said right at the beginning, this is your main cause for getting into the gig.
Yep.
How do you say, well, it's worked or have failed?
Yeah, probably not for about 10, 15 years, and I won't be a minister then.
Well, 10, 15 years, though, is going to be, you know, at the numbers we're looking at, is far too long for a lot of these kids.
But that's when I will know.
Let's
be honest. But that's when we will know, because they will be young adults that are having families of their own, have got successful careers and are moving ahead. I will know in the next few years, because we will be really evaluating and looking at the work. I won't be scared to say what doesn't work and change it. So that's how I will know. But I don't know, when I think about this, I think it'll be in years' time when I see those children that are thriving and having a successful life as adults that will really know. This is not a quick answer. You know, there is no quick solution. It shouldn't be in my parliamentary term. It won't be a 3 years that works it. It has to, I hope other parties get on board and see the merits of this very big concerted piece of work.
We hear these things with a kid that, oh, there was warning signs and this person heard and that person heard, it wasn't part. No one's held accountable at the end. If everyone else in a job kept making mistakes that resulted in whatever mistake, let alone the death of a child, someone would be held accountable. Not sharing information, things like that. When is somebody going to say, well, you didn't do your job, out the door?
Oh, I'm sick to death of it. I'm sick to death of, you know, the face of some beautiful child turning up that's dead, and then we turn around and say all of these people intervened, and everyone sits there and points fingers at each other.
When is that going to happen?
You will see we will know whether they've put the information into the system, whether or not they've been part of the solution or part of the problem, and I think you will see far clearer lines of accountability. We will also have a lead professional that is responsible for the outcomes for that young child, and that will be a huge difference. A
lot of frontline staff are saying it's not information, they know this stuff, they haven't got the staff to go and do anything about it. They need more people on the ground. When are we going to see that?
Well, they haven't put all the pieces together. You know, that's the reality of it. You know, the social worker here holds a bit, the teacher there holds a little, the GP holds a bit there, the others, community groups working. So once we put it all together, we have one plan for that child, we have a team of lead professionals and one person responsible for following it through, then we will see different outcomes. And I think what we've got is a whole lot of very, very good people spreading themselves too thin and not having a clear individualised plan. This will have accountability and also be easier for them.
So, but you would agree that there needs to be more people on the ground who get the information, they know the kids who are at risk and can get out there, can do something. There's going to be more of that.
I think it's the people that are there need better training, better supervision and better help.
So no more
yes,
staff?
I do see more moving into that area. Well, I've already put 96 more social workers into child, youth and family. I'm not saying there won't be more, but we will just look carefully at who we've got, what we need and how we move forward.
20,000 kids a year since National's been in power abused. 96 seems a drop in the ocean in that scenario.
Yeah, but we have got what we've got is, I think, child, youth and family being spread too thin. So they're working with too many children, and that's part of this plan of the white paper, is that we get them better concentrated on those children that need a statutory response. It's a big thing having child, youth and family in your home, you know, and in your lives. So they should be dealing with those kids that are really at the serious end, and then that's what this is about, is that underneath that there is a really big piece of work that needs to go on, and community responses and other professionals being involved in these children's lives. So in some respects we could lighten the workload of child, youth and family social workers and have other people intervening earlier so they don't need that big response.
So we'd like to hear what you think of Paula Bennett's plan. Send us a text, tweet or email